this poor girl was in a skydiving accident. You can see she writes she has a traumatic femur and hip fracture, and that is important. We're going to get back to that in a second. So sometimes when you have a closed femur fracture, like you can see she has right here, we can do what's called pole traction with a traction splint. A lot of times with femur fractures, your bone gets like this. You have a very painful muscle spasm, and by pulling traction, we can put them back like that a little bit. Helps with pain. Also, it can help restore pulses if we have lost circulation in that extremity. Now, what's interesting in the video is you can see they have started the application of a traction splint, a KTD traction splint. It kind of looks like a tent pole. Now, what's interesting about that type of splint is that it's contraindicated when you have a hip fracture. Now, I don't know if that's why they stopped putting it on. I don't know if they went through with putting it on. I try not to backseat other paramedics, especially when things get put online. She would probably be an inappropriate patient to put this on if she truly has a hip fracture, because what that does is it pulls traction from the ankle down, and it puts tension on that hip, which can be bad and contraindicated if you have a hip injury. However, something like this, which is a Schlissman splint, it doesn't do that, and you can use these with hip fractures. It does apply with a band around the groin, but it actually splints the hip, and it pulls tension from the femur instead of from the ankle, which allows you to take pressure off the femur and still stabilize the hip without potentially further injuring a hip injury. The Schlissman traction splint can also be used with a pelvic binder. Other things to know about closed femur fractures is that thigh can hold 1,000 to 1,500 mLs of blood. So it's a large compartment, and after 1,500 mLs, it does start to self-tamponade a little bit, but certainly enough that it could lead to hemorrhagic shock. In the video, we do see the paramedic give her some pain medicine, which is very good, very nice. That is extremely, extremely painful bone to break, and good on them for getting some pain medicine on board. She's extremely calm for the situation, and she has been commenting on her TikTok, so hopefully she is doing better.